My name is Dr. Swapnil Kenny. I am a pediatric orthopedic surgeon from Mumbai working at the Sir H.N. Reliance Hospital, which, as you may be aware, is one of the most famous hospitals in the city of Mumbai. I am here today at this Arthroscopy Arthroplasty Conclave. I do a lot of what we call as minimally invasive surgeries, stitchless surgeries, or surgeries where you don't require to cut too much. And this is exactly the meeting where all these discussions are happening. The next generation of surgeries, where patients can get operated in the morning, go back in the evening. There is minimum or zero pain. There is minimum or zero cut. There is no scar, scarless surgeries. Surgeries where everything can be corrected at one go without anybody realizing that you've undergone a surgery. And surgeries where children who are not walking start to walk, who are not able to run start to run, and those who are not able to go to school for multiple reasons, they can go to school as well. Very, very fast. So that era of plaster and non-operative treatment is slowly going towards what we call as minimally invasive surgeries or MISS surgeries, where everything will be done through a small keyhole, through a small port, or even with the help of a machine, with the help of a robot, without really having to intervene too much. So the surgery will be accurate, it will be painless, it will be stitchless, and it will be full of function. So that is the idea of trying to propagate this new technology and new knowledge to younger orthopedic surgeons so that they can learn and serve this country best. Thank you.
Good afternoon, I am Dr. Mithinachi. I am the senior orthopedic surgeon in Apollo Hospitals Hyderabad. Today, Apollo Hospitals Hyderabad is conducting the 9th edition of the Arthroplasty Arthroscopy Summit in Apollo Medical College, main auditorium. This is the 9th time we are doing this conference. I am the course director, Dr. Mithinachi, and our course chairman is Dr. Somshekhar Reddy Garu. And we have been doing this for past 9 years, since 2014. We had a break during COVID. Basically, the conference is about giving the young surgeons a chance to understand different surgeries by projecting the same videos and the masters talking about those videos. So this is a real live edited surgery conference, and this real live edited surgery conference is very important because live surgeries can have multiple problems sometimes and patient can be at risk also, but this real life surgeries are ensure that whatever surgery is being done by the doctor, their recording is there and their recording is re-edited and to be presented later in any such conference. And this is one such conference which has actually made a very important significant stress on real life edited surgery conference since 2014. This conference is also important because not only we have 150 to 200 orthopedic surgeons in attendance, but more importantly, this surgical conference has got 42 real live edited surgeries that are being showcased here, which is a world record. And not only in India's record, it's a world record for any conference having a single day, single hall exposure to delegates. 42 live surgery, real life surgeries is a very important. So basically the young doctors, PGs who are coming are getting trained by seeing the masters show the various steps of various techniques, whether it be robotic joint replacements, arthroscopic surgeries, keyhole surgeries, cartilage repairs, pediatric orthopedic surgeries, or any straightforward joint replacements, trauma. So in this way, this particular conference is actually serving as a powerhouse of knowledge, where it is showing the young doctors how to go about this particular steps in various parts of these techniques of this surgery.